Have you ever gotten a restoration back from the lab and it looks great, but you have that nagging feeling? Is this really what I ordered? Well, today we're going to erase that doubt for good. We're going to make sure you can answer that question with 100% confidence every single time.
So let's set the scene. The crown arrives, you're ready to go, but that little question pops into your head. Is this really E-max or is it zirconia? And you know what? Knowing the difference is absolutely critical. Because if you use an E-max bonding protocol on a zirconia crown, you're basically asking for a debond down the line. We are not going to let that happen.
Okay, so take a look at these two, side by side. At first glance, yeah, they could look deceptively similar, right? But trust me, the differences are crystal clear if you know what to look for. And by the end of this, you'll be able to spot them in a heartbeat.
So how do we solve this zirconia or E-max puzzle? It's actually pretty simple. We're going to walk through 4 super easy methods. We'll start with the quickest checks you can do right at your chair, and then we'll move on to the really definitive tests for when you have to be absolutely sure.
All right, let's dive right in with the fastest tests out there. All you need is a light source and your own senses. Seriously, you can do these right at the chair or your lab bench in just a couple of seconds.
So your very first clues come from just sight and touch. E-max, because it's a glass ceramic, has this beautiful translucency and feels surprisingly light in your hand. Zirconia is pretty much the total opposite. It's dense, it's opaque, and it has this distinct heft to it, almost a metallic kind of weight.
Okay, so first up is the light test. It's so easy. Just grab the crown and hold it up to a strong light. If it's E-max, you'll actually see the light passing through the edges, giving it this really lifelike glow. But if it's zirconia, it's going to look totally solid. It'll block that light completely. It's a simple but really powerful first blue. But, okay, what if the light test isn't totally conclusive for you? Well, if you have an X-ray nearby, the mystery is over instantly. The difference between these two materials on a radiograph is like night and day. Just take a look at this. On an X-ray, zirconia is extremely radiopaque. It shows up as that super bright, solid white, almost like a PFM crown. E-max, on the other hand, is way less radiopaque. See how it looks like a darker shade of gray? The contrast is just stark. There's absolutely no mistaking it. So what if you don't have an X-ray handy? And maybe the visual clues still have you guessing a little bit. Well, for those times when you need absolute positive certainty, we turn to the final, decisive chemical test. This, without a single doubt, is the surest way to confirm what you're holding. It's a very simple procedure that gives you a clear yes or no answer. There is zero room for interpretation here.
And don't worry, this test is so fast and so simple. All you do is apply 1 single drop of hydrofluoric acid to the internal surface of the crown. You just wait 5 seconds. That's it. Then you rinse it off really well and take a close look at the surface.
Now, if it's E-max, this is what you're going to see. The acid actually etches the glass ceramic, which makes the surface lose its shine and take on this frosty, matte appearance. The surface will feel rough. That reaction is your definitive proof. You've got E-max.
But what if you apply the acid and nothing, absolutely nothing happens? If that surface is just as shiny and smooth as it was before you started, then you are holding zirconia. Zirconia is so chemically stable that hydrofluoric acid has zero effect on it. No change means it's zirconia. Simple as that. All right, we have covered all 4 tests, from that quick visual check all the way to the definitive chemical confirmation. So let's pull it all together into one super handy summary slide. Think of it as a quick reference guide for your clinic. And here it is. This is the slide you might want to screenshot. It's your complete cheat sheet. Let's run through it. For the light test, E-max is translucent, zirconia is opaque. For the weight test, E-max is lighter, zirconia is heavier. On an X-ray, E-max is less radio-opaque, zirconia is very radio-opaque. And finally, the HF acid test. E-max etches, zirconia shows no change. 4 tests, 4 unmistakable outcomes. So there you have it, a simple, systematic way to identify these materials with total confidence. The only question left is, the next time a crown arrives from the lab, are you going to trust or are you going to test? Thanks for watching.